My name is Cassandra Wiley, and I live and work in Putnam County, West Virginia. When I was working full-time, the healthcare plan that I had still wouldn't cover the basics. With what I was making, I don't count it as a living wage. I wasn't able to afford medicine, even on that healthcare plan. I wasn't able to afford food. And while I was working that job, I had a mental health crisis that I wasn't able to handle due to a combination of a lot of these things. I eventually started taking less hours because I wasn't able to get the help that I needed. I wasn't able to do the healing that I needed to keep the job. And eventually ended up quitting that job, leaving me and my husband with even less resources. Just my very foundation crumbled. I couldn't even force myself out of bed in the mornings. And I count myself as a very willful person. I went to college for almost my entire bachelor's degree up until my senior year because of a financial issue. So all of these things compounded on themselves within the last 5 years for me as a young person. Sent me into a crisis I'm still recovering from, like 2 years later, over 2 years later. Eventually, I found Medicaid and SNAP, and through the application process, which took me some time, but I was able to get through, I was granted health insurance benefits for me and my husband. At that point, I was able to start doing some healing. And coupled with that, I was also approved for SNAP. So I was able to feed myself and my husband, which may not sound like that's such a big deal, but after not being able to do that for over a year, I was immensely relieved. I remember walking out of the hospital/family care that me and my husband went to with just a prescription that I was able to pay for with my insurance in their in-house pharmacy, and literally crying just because I was able to get my husband the medicine that he needed that month. We found out now that we've been able to go to doctors and actually take the medication prescribed to both of us, but mainly him. He's found out that he is having seizures without his medication that he's now on, and that's why he's been having migraines since he was a little kid. And now one pill takes care of that because he was actually able to go to the doctor. And we, as a family unit, just me and Nick, me and my husband, me working full-time wasn't enough, and that shouldn't ever be the case, much less for one of those things. But the biggest thing that I'd say Medicaid has actually done for me personally is make it to where I don't feel like I'm constantly failing because my family can't have the things and I can't have the things that I need. And that's what it became. I ended up budgeting, which I already knew how to do, just didn't have the money to do it with before then, and coming to a better place. But without that public assistance from SNAP and Medicaid, I wouldn't have done any of that healing with my husband. I would have continued to get sicker. I eventually found AmeriCorps and became an AmeriCorps volunteer. Part of the position with that is SNAP and Medicaid, so all of that remained with my position. And now that that's about over, I've been with them for almost 2 years, there's so much uncertainty on the table. I looked at the websites. I have my insurance plans all picked out already. I've done my research. But I get these whispers all the time of, oh, we don't know if we're going to keep this. Oh, we don't know if we're going to keep that, or we're going to change that. Is it worth keeping that? And whenever I hear those things, all I can think of is to be like, was I worth it whenever I was struggling? Because that's what they mean. And the general public benefits off of these. So when these things go up for grabs, that's really hurtful to hear as just an average citizen, 25. I count myself as a young adult, trying to really do my best whilst figuring out who I am and how I want to contribute to society. I haven't even had the opportunity. I was going to school wanting to become a doctor and was this close last semester, almost of my senior year, and found out that I couldn't continue 100% for financial reasons. And now looking at things, I'm so uncertain that I don't even know if becoming a doctor will sit right with my moral code at this point. because I don't think I can look at someone and tell them that I can't take care of them, because I'll get fired if I try, because they're not paying us. And the one thing that keeps coming back onto the table is healthcare. And I can't imagine a world where everyone didn't have at least access to the care that they needed and then able to choose the plan that they need. So I guess I just couldn't say it enough that healthcare should definitely be for all.